As with many aspects of our lives, technological advancements have changed the field of dentistry. How do we benefit from modern dentistry? We're asking Dr. Brian Stein of Pathways Dental Care about the latest treatments. This is Daily Web TV. Dentistry has come a long way in the past few years, and today Dr. Stein is going to talk about all the latest treatments. Dr. Stein, with all the studies that are coming out with the dental health and how it affects our overall health, can you explain to me how the two go hand in hand?
Modern dentistry has used modern science to help our patients get healthier. And studies have been shown that there is a high correlation with oral infections or low-grade infections and the overall health and systemic diseases. For example, vascular disease, where it's the hardening of the arteries, which can lead to angina, heart disease, heart attacks, and even strokes. There's also a high correlation between diabetes and your periodontal disease or gum disease, where if you have severe gum disease, it can contribute to a lot of the diabetic-related diseases that occur, and also vice versa. If you have uncontrolled diabetes, you can have severe gum disease where you get bleeding, loss of bone, loss of gums, and even loss of teeth.
So there's a reason why things are happening in our mouth and our overall body, because it's all connected.
That's correct. Even in pregnancy, studies have shown that you're 7 times more likely to have a baby that is born early or a low-weight baby as a result of that low-grade periodontal gum infection.
Well, I must have had great teeth because all my kids were overdue.
And you do, looks like you have nice teeth.
Now, how do you educate your patients with making sure that they have overall good dental care?
Well, we've got a lot of modern equipment that we use to help us with that. So when we get in our new client exam, it's important that we gather all that information and educate our clients. And one of the main things that we use is what's called an intraoral camera. It just takes snapshot pictures of everything that we can see. So then when we sit the patient up, they can see what we can see. And like they say, pictures can say 1,000 words. So it really helps them because it's important that you make the proper decisions, and you need to have all that information so that you can make those decisions for your correct health.
What other tools do you use in our mouths every day when we come for our visit?
Well, we also use digital x-rays, which is great because you don't have to worry about all the chemicals and the environmental issues with that. Also, it's an immediate, so you take the picture and it's immediately right up onto the computer, which is a large screen that you can see very easily. It also has 8 to 9 times less radiation than the old type of x-rays that we used to use. We also do intraoral cancer screenings for our clients, and we use something that's called the valvescope to help us with that. We used to just do that exam visually. So whatever we saw, if something looked suspicious, we would take a biopsy and then send that away to make sure it wasn't anything cancerous. But now the valvescope allows us to look even deeper into the tissues before things can be seen, so that you can detect things earlier, and that's one of the most important things when you're dealing with any type of cancer issues.
So you've given me lots of information to think about for my dental care. Now, I have heard you can do a crown in a day. Now, how is that possible?
That's correct. It's something that we have here, which is also a wonder of modern dentistry, is called the CEREC machine. And what it is, it's a machine where we can design and mill a crown right in that same appointment. It's a tooth-colored restoration. And what we used to do is you'd have to prepare the tooth, take an impression, put a temporary, and while you're waiting for the crown to be made in the lab 2 weeks later, you come back and you have another appointment to put it in. This way, we can do it all in one appointment. We capture the optical impression, send it to the computer, and then it mills it. It's actually quite a nice feature, especially for people who are very busy and they can't come in for multiple appointments. You can even take that one step further. We can do a root canal, which also used to take 2 appointments, and the crown used to take 2 appointments. So that's 4 total appointments. We can actually do that all in one day now. We can do the root canal, do the crown, have everything all finished, so you don't have those multiple injections, multiple appointments, and helps you free up your schedule as well.
Well, thank you very much, Dr. Stein.
You're welcome.
For more information on Pathways Dental, visit their website. Inspiring you with tips, ideas, and advice from the experts, I'm Tracy Bizot, and this is Daily Web TV.